Our study of the long-term effects of traumatic brain injury involves studying folks with a single moderate to severe or mild, significant mild TBI. In other words, a person who's had at least a significant period of post-traumatic amnesia or loss of consciousness, or a person who's come to medical rehab for the rehabilitation of their impairment secondary to a TBI. So we're not dealing with athletes, we're dealing with civilian injury. I would say the main goal of our research is to deal with the concern as to whether or not CTE is a public health concern. So if we see that CTE exists in the civilian population, then we have one game. If we see that it doesn't really exist or it's not prevalent in this population, then we have a different game. So I think it's really a groundbreaking study that will lead to the rapid development of future inquiry, because there are clearly two paths here. I think it will basically open the doors to big data. I think Fitbit, once it realizes its potential, will be there for, we've been talking for 10, 15 years now of the need to better classify TBI so there can be a better fit between diagnosis and treatment, and that TBI is not is an entity like breast cancer, where there may be differential forms that are differentially treatable by different forms of intervention. And until we have the large-scale data, we can't do that. So I think, and NIH has put all this money into failed clinical trials based on solid animal models, and I think this is the solution. Oh, they can donate their brains. That to me is the most important thing that people can do, and I think people need to be patient with science. I think we realize that there's a tremendous amount of pressure here in order to get out some answers on traumatic brain injury and its long-term effects. But in order to do it right, it takes time.